You are listening to Love Your Practice with Dr. Laura Mock. I'm a general dentist, a practice owner, and a certified life coach. I teach women who own dental practices to lead with intention and literally fall in love with their businesses. Keep listening and you will see how learning to love your practice turns into loving your life too. Well, hi ladies. Welcome back to another episode of our podcast here, Love Your Practice. I'm Dr. Laura Mock, and we talk on this podcast about leadership issues for women who own dental practices. Today, I have on the podcast as a guest, Brandi Hooker Evans. She is amazing, effervescent, and full of wisdom. And you will find as you listen that her unique position as an educator, an owner of a practice, and a hygienist gives us some very unique perspectives onto common problems that you all as my listeners run into. So listen in as we gain some wisdom from her, and I'll see you on the other side. Okay. Well, I would like to welcome to our podcast today, Brandi Hooker Evans. Brandi, thank you so much for joining us today.
Laura, I have been looking forward to meeting up with you so much I can't even put words to it. So thanks for having me.
And you're welcome. So I asked you on here because you have a really unique perspective that I think my listeners would like to hear from. And I'm just going to briefly describe to them what that perspective is, and then we'll kind of jump into the questions that I imagine my listeners would have. You have this very unique position in that you are a hygienist, very well qualified one. And how many years have you been practicing as a hygienist?
17 with my license.
Nice.
19 if you add school, which I do add school.
Okay, 19 years then. We'll just say 20.
Well, I mean, yeah, round it up, 20. Let's go with 20.
Yeah, 20-year hygienist. And you are also a practice owner. You co-own your practice with your husband, who is a dentist.
Yes, ma'am.
Yes. And you lecture on subjects regarding periodontal disease and caring for our patients. Is that correct?
True.
Yeah. Okay. So like what kinds of things do you teach in a dental meeting?
So my favorite thing to teach is how to stop telling your patients that they have periodontal disease and let them tell you. And so I take the audience, and I really do prefer to have the whole team there. As a leader, you know that if one part of the team has a good plan, it doesn't matter. We got to have the whole team having the whole plan.
Mm-hmm.
So I take the office team on a journey to really loving the patients well, showing up for them as an individual, exquisite care provider, and giving the patients the tools they need to autonomously make their own decision about the state of disease or health that is present in their body.
Mm-hmm. Wow. That sounds like a lecture I would love to attend with my team, because we're always trying to elevate our care. And I love the idea of really enveloping the patients in care, whether it's the amount that we care about them or the knowledge that we have, and helping them implement the knowledge that we have into their own lives for their own health, and making ourselves like a non-negotiable in their life.
Right. And a facilitator rather than a dictator. You know, everyone wants to have courses on case presentation. And I'm like, what would you feel like if you could just skip case presentation? What would that be like if your patient was able to sit with you looking at their perio chart and their x-rays, or perhaps their gums aren't the issue and it's the teeth. And you can look at the x-rays with the doctor and the hygienist and say, gosh, Dr. Mock, what are we going to do? Rather than you as the doctor or me as the hygienist giving the patient a diatribe of the state of decay and periodontitis that they have, and then letting the patient decide, do they trust us? Is this true for them? Does this matter to them? Is the disease something, even a possibility for them to do something about? Like, we take all of that and just whoosh, wipe it off the board, and we sit with the patient and we look at the situation in their mouth and with the assessment and say, okay, what are we going to do? And then that's where you and I come in and we say, I'm so glad you asked. Here are the options. How would you like to proceed forward? And so now we're partners in their journey to health, not dictator, Charlie Brown teacher, finger waggers telling them that they're dirty and bad for not flossing.
Yes. You know, I so agree. And I have been experiencing this recently in my practice ever since I implemented salivary testing. And I get somebody who's got a bunch of P. gingivalis or AA or any of those other red complex ones. I go, okay, this person needs to come in to talk about their results. And I don't charge for this.
No.
Because actually it's kind of fun. I usually do it at the end of the day when we're almost done anyway. Sit them down and I go, here's the levels that are high in you, and here's those bacteria. And I have this sheet that kind of teaches them.
Mm-hmm.
And then of course the systemic links at the bottom. And they go, well, so what do we do?
Mm-hmm.
And that's when you know that you're in that trusting relationship where you're finally in a position where you can make your recommendations.
Right. And what's additionally beautiful to that is that you're also taking the weight of their health or disease off of your shoulders. One of the things I noticed about the life-sucking opportunity that dentistry has for its professionals is that we go home at the end of the day with the level of disease that is in our patients on our shoulders. And when we really step into, instead of facing them, turn next to them and move forward with them, their disease is theirs, and it just creates a space where we're able to love them and help them with the disease, but it's not ours to take home with us. So when you get done with the day, regardless of what patients have came in, you have some energy for the rest of your life, which I think is highly critical, especially in a profession where the burnout levels tend to be extremely high. There's a path to better. And so I am, digging and scraping and looking for all the ways for us to truly enjoy what we do, which then turns into being incredible blessings to the patients that we serve, which is why we went into dentistry in the first place.
Yes. I would like to expound on what you said about taking the burden home, because this happens a lot with my clients and me, because I'm human brain too. So this is what I do. I accidentally put a should on my dental practice, which is if I'm trustworthy, if I'm good enough, both at providing, diagnosing, and talking to my patients, if I am all those good enough things, my patients should take my advice. And that is a belief that I carried around for a long time that put a burden on the patients to make me feel good about myself.
Right. What a lead anvil.
Oh my gosh. And that turns into pushy sales because we get a little graspy. We get a little bit like we need them to say yes so that we can go home and feel good today.
Mm-hmm. Yeah.
And once we recognize that thing that we made up, this is, if I am good enough, they should take my advice. No, give me your hand so I can slap it.
I know.
That's not correct. And it releases everybody from the burden of making sure that Dr. Mock feels good about herself, right? I can feel good about myself because I know I'm offering my patients the best care. And if I don't know that, then I can work on that instead of working on trying to make my patients, like, educate them into submission so I can feel good.
Right. It's such a downward spiral. And what I love about the solution is it's pretty simple and not hard at all to implement. I mean, it isn't hard to implement. You just have to have a couple little pieces of information and tweak the way that you look at the situation and respond to it. And once those happen, then the conversation about the salivary testing where the P-Ginge is occurring, and then we know that 96% of people who have Alzheimer's disease have that P-Ginge in their spinal fluid that they were able to trace back that started in their mouth. then that becomes a fun sharing point that happens organically and out of love, not out of, I'm going to make you scared about getting Alzheimer's disease.
Mhm.
And so then now the patient is like, they don't feel your pressure of your should on their shoulders either. It's that exchange of energy that is just out of balance, which happens to all humans at different times in our lives and in different situations. It's normal, but we need to take the time to recognize that those shoulds in both directions aren't helping either one of us. And so we want to flip that to, how do we move forward in a productive way? And honestly, I think one of the first steps is, as a practice owner, is to look at the team that you have and figure out who on that team has skills that are being underutilized. Who on your team really ought to, maybe not ought, that's should. Who on your team could bless themselves, your team, and your patients better with a little more responsibility? And in this situation, based on the education, a lot of times it's the hygienist. So that opens up a whole realm of conversation where you can get the hygienist fired up about how amazing their career can be and what kind of care they can provide for their patient, and then get them directed on a path that will elevate the standard of care for your whole office and increase everything that you wanted to increase, and let some of the things that are not helping you just wash away.
Okay, so I'm just going to play I am my listener right now. Okay. And what you just said is so good, but my listeners are raising up their hand going, well, yeah, but I can't even get a hygienist to come to work for me, let alone to be fired up. So this is where the intersection of you being an owner and a hygienist is so valuable. Like, okay, what do they want from us? And also, how can we create better synergy in our relationships with hygienists? Instead of this opposition, which I feel like got so much worse during COVID, when we were all angry at each other for how we were going to reopen, um, like there, and then the hygiene shortage, because so many hygienists just didn't want to come back. So you say, let's fire up the hygienist. And I say, or my clients are be like, well, how about if we start with a warm body?
Right.
So
You
talk
have
to
a
us about
pulse, you're hired.
that.
Yeah. Okay, so that is a really great question. And when we're looking at a teammate, for example, what I try to teach other humans is, you want to be the person that everybody wants to have on their team and nobody ever wants to lose. Now, as the practice owner, you have to flip that script, and you have to be the team that everybody wants to be on and that nobody wants to leave. And there, again, I love little roadmap to success. There are a few steps to that. And it really does start with your heart. Do you really want to be that team? Or are you secretly an associate that wants to clock in and clock out and not cultivate this type of office environment? And you have to get real clear about that, because it's okay if you're the associate that wants to clock in and clock out, but then you need someone either on your team or outside of your team that is going to be in charge of that heart piece about cultivating this team that everyone wants to be on and nobody wants to leave. And it's really simple things. I own a practice in Pocatello, Idaho, alongside my husband, and we are an individual small family practice. So when you look at our benefits compared to the benefits that corporate dentistry can offer, on paper, it's, worlds away in paid days off and, insurance and all of these things. However, what you get in the untangibles and tangibles that are different than what corporate dentistry provides, it's still a beautiful, shiny, and I think shinier opportunity than corporate dentistry. But it's because the heart of the team is we are a family. We're here to take care of one another. We're here to provide exquisite care to our patients. We're going to dine together regularly. Like we have lunch together once a week. We meet once a month and at our team meetings, in addition to, hey, let's work on this for infection control and let's keep an eye on this. And oh, we got a new software or whatever the situation might be. We stop with all of the housekeeping items and we play together. Our favorite game is left, right, center. There's usually a couple of envelopes of anywhere between $5 and $20 that you try to win. And we just enjoy each other's company and do a little gambling just to take care of everyone's soul. You need to have some fun when you're at work. And so that heart piece of, hey, this is a great place to be because we are humans doing human things, and this is your family away from home because you'll spend more time with us than you do with your family. That has to be in place very first. And that is how you attract people that want to come and work for you. And it is not that hard, but when it's not your routine and not your habit, it's a totally different approach to how days go at the office. And so step one is you got to get your heart in it.
Okay. So let's take a step back here. It sounds like you're telling me that hygienists want to be a part of a team that watches out for each other.
Absolutely.
Is that the main thing that they're looking for? What else do they want from us? Brandi, help.
No. Okay. So this is a twofold problem because I think hygienists are half the problem in this equation, if not more. And since I'm on the hygiene team, and I believe if you look in the mirror, as long as you're the problem, you can be the solution. We're going to hang heavy on what's wrong with the hygiene side of things. And I believe there's a lot of information about running the practice, that opening the doors, having the lights come on, that hygienists don't know about. So I think one way to bridge the gap is to create a situation, have conversations that include the business end of dentistry. So often hygienists will hear these talking head influencers that are like, you should make $100 an hour and you should have 6 weeks paid vacation and you should. And then these men and women with hygiene license who in some situations really and truly are just pickers and scratchers of teeth hear this and they want to demand that. So then now there's this like big messy gap of we're not providing good care, but we feel like we deserve all of this because we simply have a hygiene license. And I want to say BS. If you want to have these benefits, you have to show up and be so much more than a picker and a scratcher. You may not be an overall healthcare expert, you can treat any disease, but you are an overall healthcare expert screener. You have an amazing, and we don't even have to get into what happens with the gums yet. But when a human being comes in, you are qualified and licensed to evaluate their health history, to evaluate the way that their face looks, to evaluate the way that they walk, what their blood pressure reading is. I mean, as the hygienist, you first have to elevate what kind of care, what kind of a provider are you? And that's critical. And so I think right there, when you look at the hygiene population, there's the bell curve, as there always will be, the top 5% and the bottom 5%, everyone in between. But as the business owner, you got to look at that bell curve, and everyone that's on the bottom that just wants to pick and scratch and make a killer wage, clock in and clock out, those are not the hygienists that you want to attract. It would be better to have your hygiene program on hold than it would be to employ and have that type of, in my opinion, negativity in your practice. You as hygienists, we also have to elevate practicing to the maximum of our license and our education. And that's a hard pill to swallow for people who want to do the bare minimum. And so I don't operate in the bare minimum. That's not my gig. So the conversation to me has to be like, okay, hygienists, we got to put our big kid pants on and show up with some education, some continuing education, some real dedication to being an exquisite oral health care specialist. So that gap can ruffle a few feathers.
Definitely, because there are people who will go into the profession because it's like, oh, it's a 2-year degree and I get, $70 an hour when I graduate or whatnot. But I think also what you're trying to say is that a quality hygienist wants to be in a place where they are nurtured professionally. They can do their nurturing and be nurtured.
Yes, absolutely. And so to attract those hygienists that are doing that type of care, not only do you have to be creating that situation at your office, but when you reach out and talk to people, which is how you find a new hire often, or if you place an ad, all of those things, or use a temping service to do working interviews, your language has to match that.
Mm-hmm.
And then when they come to your office, your care, your habits, all of the, culture has to match that elevated standard. And so it's not that hard though, right? What it typically the difference between ordinary and extraordinary is that little extra. And so for dentists, when you get to work, say hi to everybody, check in with everybody that's on your team.
Mm-hmm.
That one little piece right there is going to change the trajectory of the entire day. When your team feels seen, heard, wanted. Hey, how was your kid's soccer game last night? Just basic pleasantries will put you on that road to amazing team. But I think so many of us get in the habit of, oh, we're in a hurry, we're sliding in, we're drinking our protein shake, putting our hair back in a ponytail and putting our lab coat on at 8:02 when the meeting for the morning huddle starts at 8:05. And we're missing that opportunity to love the people around us really well.
Mm-hmm.
And so it's basic. It's what you learn in kindergarten. Like tell everyone hi, shake their name, go find out what Laura's favorite color is.
It's purple.
And what a lovely blazer for you to match your favorite color today. So that's simple. And I think that's annoying. Honestly, if we're calling it out and people are listening, when you hear something basic like that, I feel like there's a lot of people that are assess it as being totally annoying because, wait, you're telling me that to get my office to be the place that hygienists want to come to, I'm supposed to ask about my front desk's soccer game for her 6-year-old.
I mean, I can see both points. I can see both perspectives.
Right.
But I will say, as someone who has owned a practice for 15 or 16 years, your employees' feelings matter a lot. And I'm not saying that we should bend over backwards and break our own boundaries to try to keep them happy. But since our feelings direct us as far as like what we do and how we do it, you can't assume that your employees are robots who are just going to do what you say.
Right.
Because they're humans.
Right.
And that means they're going to do what their feelings tell them to do, because that's just how we're set up as organisms. And if you ask your team how they're doing, if you engage in their lives, then they're going to feel supported.
Mm-hmm.
They're going to act supportive.
Right.
Pass that on to your patients.
Well, and when you look at the statistics around gratitude, people who feel like they're worthy and appreciated work so much harder than those that don't. It's over and over. In Japan, the people who work for companies feel like even though they don't own the company, that they own the company. And so you see a whole different level of work ethic and dedication and collaboration. And so I think that it's very important to realize that if we can realize that the people who are surrounding us are surrounding us, they're holding us up, they're holding us together. And if we can interact back and forth, not only do we want to know how they want to know how we are. And then that becomes the team that everyone wants to be a part of, because you're going to show up, and whether you're having a good day or a bad day or a ho-hum day, at work is a safe place where you are nurtured and loved. And then we take it to the next level where you really do let all of the people on your team work to the max capacity of their license and abilities. You might not like to organize a fun team meeting like I was sharing about, but maybe your gal that answers the phone and does the scheduling is phenomenal at cute little get-togethers, and you just give it to her. You just say, hey, here's the deal. For 1 hour every single month, I want something fun and unique for us to get together and break bread. And maybe we do a little housekeeping items. And then you just delegate that thing that you don't like to do to someone. And now this person who was just your front desk girl, all of a sudden is the team leader that is cultivating a culture of excitement, of appreciation, of enjoyment, and of fun. And you didn't have to do anything. You just had to recognize that Susie loves Pinterest and can show up on May with little lemons and, this deli sandwich. And all of a sudden, everyone's having a lot of fun on your team. And it didn't cost you anything but a little delegation and maybe, $30 for the team to have lunch.
I mean, what you're saying is that if you don't like this team collaboration is important, but you don't have to be the leader of it. You can recognize that you're not that person and ask somebody else to do it.
Yeah. You want to wow your team? Go to the gas station, get however big your team is, enough for everyone to have two $1 tickets, let's say, of lottery tickets, and schedule a team lunch and pass out lottery tickets and pennies to scratch them.
That sounds like fun. And it's inexpensive too.
Right. So those are the things that I think are overlooked, but that is the difference between the team that people are like, I work at Evans Dental and I work at Evans Dental, right? It's just not that difficult, but we do want those members of the team to feel really supported and loved. And when you have a hygienist apply to your office, or let's say you don't have anyone apply, but your team is reaching out to hygienists that they know, that word of mouth, just like those are the same patients we want the word of mouth patients, not the Groupon patients. I mean, the Groupon patients are fine for some practices, but there's a lot of situations where you really want a dedicated patient that is going to elevate the practice and vice versa. So it's a, mutually beneficial relationship. That's what we want when we're doing hiring as well. We want the administrative amazing rock star to recruit, Sally to come be a part of this really fun team.
Yeah. Like, hey, Sally, we're having a good time every day. Yeah. And we need a rock star like you. Do you want to come check us out?
Yes.
Okay, but let me ask you this. So let's pretend we've had a hygiene program that is adequate, but not like what you're describing. And we have a good, solid hygienist who's used to her role as a picker and scratcher. And we're wanting to elevate her career, elevate what she's offering to the patients. Now, this is a great question for you because you're an owner and a hygienist. What does that conversation look like when we approach her or him and say, we're going to change what you do?
Great.
What does that look like?
So it, in my opinion, starts with a question. You call me into your office and you say something like, Brandi, close the door, let's have a seat. And then I'm sweaty. Just kidding. Don't. Say, Brandi, I would love to have a conversation with you about our patient care. And at that point, you say something to the effect of, why did you become a hygienist? What are you
I like
hoping?
taking care of people.
Right. So you like taking care of people. Awesome. I think that what we're doing is brilliant and really awesome. There has been some information that has come to my attention that leads me to believe that we could take even better care of our patients. What do you think about that? And the
Well,
hygiene,
I love taking care of patients, but it sounds like I might run over if we do that fancy stuff.
right,
I'm not sure. I feel apprehensive about what you're talking about. I don't know if I want change.
right. And so then ask her, what do you want for, if you could have anything in your career during your clinical day, what would it look like?
Mm-hmm. Well, I'd want to know that I was taking really excellent care, and that's something that every hygienist wants. That I've ever met, they want to know that they're taking excellent care of their people. I want to do that, and I don't want to be rushed, and I want to be really well paid.
Great. So would you be willing to try out a couple of new things, taking everything that we have so far and backing off on the expectations, trying a few new things and seeing where it leads us?
If maybe, like if I knew that it would get me to those things, well paid, excellent care of my patients, yeah.
Okay. So what if I told you that I have seen a hygiene program see half as many patients, but make 2 to 3 times more money in those half as many patients?
So like I could go slower but make more.
Yes.
Yes, that sounds very interesting to me.
Okay, great. Then you either read a book, go to the continuing education classes, have a coach. There's lots of hygiene coaches that do this, not just me.
Mhm.
and and you try out a new program. What I invite people to do is just give this system of care, take the patient through assessment and get them to diagnose their own disease.
Mhm.
Give it 90 days. And if it is not working, totally scrap it. But what's funny is once they learn it, it's working by that first week.
Mhm.
And so by day 30, they're in it forever. So that's your conversation. Figure out what she or he wants, figure out what they're hoping for, and then tell them that you believe there's another way to meet all those needs that will support not only them as the professional, but the patients to be even more well taken care of. And this is where it gets cringy for the typical production assessment practice owner. Is there's going to be days where we take our patients from the prophy to scaling and root planing, and we don't bill a hygiene service at that appointment other than the x-rays and the exam.
Mhm.
And that's really scary because you're like, well, I need to get that extra $100 for the prophy, and otherwise my production is going to look bad today. But what I argue is if you had an hour for the prophy, but it took you 45 minutes to get through all of the assessment for the patient to diagnose their own disease, that now instead of that $100 prophy in that 1 hour, you have $1,000 worth of dental hygiene care that is going to happen in the typical, if someone's like a regular scaling and root planing middle of the road, offices typically don't schedule more than an hour and a half per half mouth.
Mhm.
And depending on the hygienist, that might even be more than what they would need or want. It might be an hour for a half mouth if we're not doing the assessment. So instead of producing the x-rays, the exam, and prophy in 1 hour, in that hour for the exam, and let's just round up and say 3 hours, now we're producing $1,000. So that divide that 4 hours and you're still doing $250 an hour instead of 100 per hour. And that's really erring on giving them so much time that they're sitting around and having coffee with their patient. because there's a lot of patients in the early disease that don't need that much time.
Especially if they've been coming in every 6 months. They need
Right.
some flushing out, they need some lower gum stuff, but there's not a lot of deposit.
Right. It's
Like kind
not
of converting
hard
one of those
patient.
patients to perio is not actually very much physical work.
Right. It really isn't that much time. And so obviously the nuances this is for a whole nother day. But the bottom line is what we're doing is discovering work that needs to be done. We're getting the their own disease so that they are committed to the concept, like the next appointments, which are going to be the scaling and root planing and then perio maintenances, which you're doing saliva testing. If they've got the bad guys of periodontal disease, they need to be coming in every 3 months. We're not doing this like, oh, we just need to get you caught up scaling and root planing and then not seeing them. That's not helpful. And so now we're in this situation where we do amazing assessment. We get the patient to diagnose their own gum disease and we get them to come in for the care. Then as we're moving forward, the hygiene program all of a sudden is producing 2 and 3 times what it was beforehand, but we're scheduling appropriately for the amount of diseases present. So instead of Brandi sweating through her lab coat, not having a bathroom break or a snack for 6 weeks, I'm scheduling to meet the disease level of the patients, just like you do. If you have to do a root canal, a buildup, and a crown, you don't schedule that the same amount of time as an occlusal filling. You schedule appropriately, and that production matches the level of disease that was present, right? A root canal, crown, and buildup is what, $2,500?
At least. Yeah. Maybe 3,000.
Right. So what would you put that in? Like a 3-hour time block?
Well, I don't do root canals. So I don't know. But I know what you mean. Your point is well taken. Like the hygiene, they get, a certain amount of time and it's the same for everybody. But you're suggesting that scheduling appropriately can actually be more financially beneficial and the hygienist can feel supported and not overworked.
I watch it happen time and time again. I mean, the typical production in Idaho when I first started doing all my statistics, which sadly, based on the dental prices and reimbursement, has not changed that much in the last 10 years. The typical production of a hygienist in Idaho was $800 to $1,200 per day. I don't know, is that similar to Iowa?
Yeah.
So, and they see roughly 8 patients a day, 8 1 hour. Well, when I would show up and I would be a fill-in or I would do it in my own office, like I would test this out. I was producing between 1,800 and 2,600 a day just based on what the patient needed. And many of those appointments, if you don't have time to do that scaling root planing that day, you just bill the periodontal comprehensive exam, the DO180, and the x-rays, and then you schedule them back for the rest. And time again, I mean, it was just like clockwork. It's so much production, but yet instead of being rushed and overworked, I was having a great time. I was having great conversations with my patients. I was helping them get healthy instead of recommending that they brush and floss well. We talked about, playing the game Find the Veggie or going for a walk after work. And so then not only are my patients getting healthier, I'm producing like a wild banshee. And in 3 months, my patients are coming back healthier. And then 3 months after that, they're coming back even healthier. And then pretty soon, a year later, you can, and I would love to do the saliva testing, you can see that the type of bacteria have totally changed in that 1 year of scaling and root planing and perio maintenance appointments. And so since people have disease, there's a lot of production available, not to have your hygiene program make money, but to address the disease that is in your patient population. And the disease it does not care about your socioeconomic status. It does increase with age, like most things, but it doesn't matter if you're a fee-for-practice service or insurance or, you know, a Medicaid practice. There is the same amount of disease across the board, you know, nation and actually even worldwide. So by addressing the amount of disease, then you naturally can schedule for the amount of time that you need to provide that care, which then increases your production, and then everyone's happier. The patient is healthier. The hygienist loves their job. And the doctor is watching their patients get healthier and their practice is getting healthier, so that, and this is my favorite part, when you come across a patient that is down and out, having a hard time, truly does not have the resources to pay for this additional care that they need, you get to look this human in the eye and say, I am so glad that you're here and ready to take care of yourself. Will you let me just do this for you?
Mm-hmm.
And then everybody's crying and it's so much fun and you're making a difference, and you go home and you have energy to run carpool and cook dinner, and you are excited to hike on Saturday because dentistry has not sucked the soul out of you.
Yeah.
You've made a difference. And so all of these things snowball together. They're very simple pieces, tiny tweaks, but the amount of effort that it takes to make these tweaks is so minimal in comparison to the reward you get. And when you're looking at the doctor and the hygienist and that typical contention, now we're in a situation where at lunch, Brandi and Laura are looking at x-rays and what do you think? What do you think about that PDL? What do you think about that lamina dura? Dr. Laura, when you sit down to do an exam, will you show me how you learned to do the teeth part of the exam so that I can be aware of what you're looking at and what you're looking for? And when you sit down for that exam, we can have a great conversation that I bring you into instead of you starting from scratch. And so you can be welcome in and hear that Sally likes to hike and that there is potentially decay in these 3 areas, and reinforce that I've shared with Sally, if she wants to drink soda pop, to stick to it at meal times instead of sipping on it all day long. I mean, and then so now not only are you more personally involved in the exam with the patient and connecting with them, you're also connecting with them faster, because you and I already have what we're looking for decay, what we're looking for periodontal disease. Like, we are on the same page. So now the exam becomes more fun and you have this deep of a connection with the patient in this much time, because you have elevated the way the exam goes by bringing that hygienist up to a higher level of care based on your philosophy of practice.
I mean, having a hygienist who helps you with the restorative treatment plan by raising awareness and being on board with that is like a dream come true for doctors.
Right. And you don't have time to, in my opinion, start from scratch, because not only does that take more of the minutes, but it also takes more of your soul and more of your resources. Whereas the hygienist, I've already combed through the x-rays with the patient. I've already combed through their periodontal chart. You and I have already looked at these types of cases outside of this. So I know what is important to you, and I can assess the situation and then let you diagnose from there. You know, in this situation, you might do a filling and you might do a crown. That's not for me to pick. But if the patient has decay, then that conversation of what's going to be next for them shouldn't be a surprise at the exam. That's not fair to the patient, and that's not fair to you as the doctor, and it's not fair out of respect for my license. You know, I know that there are a wide range in education. I have a bachelor in dental hygiene, Bachelor of Science.
Mm-hmm.
And so I feel like I got a really, really strong education. But as great as my education was, it doesn't drop a tiny drop in the bucket of water of the last 17 years with what I've learned working side by side with the doctor, with working with patients, with working with other hygienists. So we're really looking at no matter where your education started, where can your experience grow you to?
Well, and I would add all of that. Yes, 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 yes. And for my listeners who are all dental practice owners for the most part, if a hygienist comes to you and they say, I see a problem here, we were thinking maybe it's a cavity. Like, even if you don't see a cavity, you need to make sure that you reward that hygienist for bringing that concern up. Don't poo-poo her. Don't belittle her. So respond in kind to what you would like to see more of, because I so appreciate it, especially subgingival crown margins.
Absolutely.
Y'all are going to see
Not
that
picked
more
up on
than
the x-rays. Yes.
And I need to see though, if there's caries underneath the crown margin, it's better to know that early.
Right.
So to add to what you're saying for my listeners, please, 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 as your hygienists are pointing out problems, please respect them and listen to them.
Well, and then it becomes such a great area of conversation because you can go back over lunch and look at the x-rays and look at the, intraoral pictures and have that conversation so that the hygienist can really get to know you and get to understand what you're looking for. Because if the hygienist feels valued and supported, they're going to be your best detectives. And you want them to be, because if a patient comes in and, a middle-aged mom's all of a sudden decided that they're going to do liver cleanse and get rid of all the toxins in their life. And so you have this 45, 50-year-old woman drinking lemon water to flush her liver all day long and has decided that fluoride's never okay anymore. Right? We have these patients that come in and they don't realize that you can get rid of fluoride, but the path is you can't just do it. You have to have a real plan in place. And then they're sipping on lemon water all day and they've got incipient lesions throughout their whole mouth. Well, you better hope that your hygienist is having this conversation to set you up for success when you come in the room to really talk about remineralization. I mean, that's going to have to be number one. Or when you see them again in another 6 months after they've added swishing with apple cider vinegar before every single meal and the lemon water, and you have to do a full mouth reconstruction. Like you want that back and forth, and that how do we really serve our patients so that, again, the reward, the fulfillment inside of your soul as both the hygienist and the doctor just skyrockets.
Yeah, I love that. That's what we're looking for. That's what I think we all want, the doctors and the hygienists. If we can keep that as our goal and implement the simple things that you talked about today, I think we're all going to be that much farther forward and that much closer to it. It's a way more fun way to practice.
Oh, it's so rewarding and so fulfilling. And it is, I don't believe the reason you should do anything is for the money. But I do believe when you do the right thing, especially in dentistry, the outcome is quite lucrative. And then you can bless yourself, your family, and your community with the health and wellness of this financial business, because dentistry is a business. At the end of the day, I can talk to you about sunshine and rainbows, but we've got to turn on the lights, my friends, and we have to order diamond burrs, and we're going to need some prophy paste. So like there's a business to be ran, and so we get to pick if that business pays the bills or if that business makes our heart sing with plenty left over.
I think you can do both.
I know you can do both. I watch it over and over and over with my own team and with all of the teams that I get to coach, and even just, people that will come to a seminar and get this way to get your patients to diagnose their own disease and get the hygienist and the doctor to stop fighting and start realizing that we're the A team. We're not a team, we're the A team. And together we can change the way all of this goes. And it does not take away from either person. It just builds on both.
Yeah. Well, Brandi Hooker Evans, we have been very enriched by your wisdom. And like I said, you're very unique perspective as both a hygienist and an owner and an educator. It's amazing. Thank you so much for your time.
Well, thank you so much. And to everyone that tuned in, I am sending you so much love and hope for your next chapter. I really believe that there's so much more available to us if we're just willing to take it.
Yeah. And you have a study club.
Oh, yeah, I do. I have the Stellar Infusion Study Club. It
Stellar
goes,
Infusion. Okay.
yes, yes. The name of my company is Stellar Outcomes. So there's all the, play on words.
Mhm.
It goes from September to April. So if you check out brandihookerevans.com, you can get a free ticket for your 12 credits a year that is recognized in most states. If you live in California, you have to that's separate. But if
Okay.
you're interested in the way that I practice and the way that I teach, my book, Dentists, Hygienists, and Cows, is available on Amazon and Barnes and Nobles, and it is the how-to guide in 150 pages. It's, in my opinion, really funny, fun, easy read, and it will give you and your team the tools that you need to implement this way of practicing. So feel free to grab that and
Can
book club
you
it with your team.
supply us with the best link
You
that's
got
the
it.
best for you for us to get that book?
Yeah, the very best is going to be on Amazon. I'll send you the link, but there are not any other books called Dentists, Hygienists, and Cows, and there's not very many hookers out there. So if you just even Google my name on Amazon, I guess it's not Google. If you Amazon
Search
my
it.
name, my
Yeah.
book will come up, and you can get that either on Kindle or a paperback version. And if you book club that with your team, you'll have what you need.
Yeah. That's amazing. Congratulations on finishing your book, having it out there. And thank you again for your time today.
Thank you so much for having me, Laura.
Thank you for listening to Love Your Practice with Dr. Laura Mock. I would love to meet you. To join our movement, find the Facebook group called Love Your Practice and request to join. If you can't find it, just send me a message and I'll add ya. You'll find me there helping all of my ladies to fall in love with their businesses and have a better life.